I'm Benoy Mathew. I'm a musculoskeletal clinician currently working in GP practice, and also I'm based in Guyson St. Thomas's, where I work as an advanced practice physio as well. So the main thing was looking into application more in an emergency setting. So we see a lot of these patients in primary care, and sometimes you just have a clear focus question. For example, if the patient just has knee fusion or an ATFL ligament injury, so you're looking for a specific answer here. So that's where I think the focus is really useful. So this is where I think the small group setting and also looking at the primary care physician appealed to me. So that's one of the reasons I decided to attend the course. I specifically wanted to know more into looking into assessment of dislocation and fractures. So if somebody comes with an acute shoulder, how do you sort of look into dislocation of the shoulder, metatarsal fractures, those sort of things, which is not routinely done in most courses. So it's sort of those sort of acute cases is what interested me, rather than the routine MSK ultrasound. Yeah, so it sort of caters to, you can see a real mix of people from GPs as well as people, A&E practitioners, and more clinicians are using ultrasound in primary care. So it's no more like the confine of just the radiology department. So if you're dealing with sort of mainly in primary care or emergency care, and you're sort of seeing a lot of those kind of musculoskeletal conditions, and you sort of want to incorporate this as part of your clinical assessment, then this is a great tool. It doesn't really replace a full like a PG certification, but this is for clinicians who want a quick look, help them to make a diagnosis, and most important, the right decision which will help our patients on the appropriate pathway. So in those sort of situations, I think this is a fantastic course, and the main advantage I feel with this course is the small group setting. So you have more of lots of hands-on time, and Max is very friendly and approachable, and which means like you can sort of really cater to your sort of needs and make it a bit more applicable in your day-to-day setting. So I think the practical application is generally what has appealed to me, sort of looking into clinical application, and it's run by clinicians for clinicians. So you really feel that it's something which you can apply straight away in clinic the next day. If you're looking for sort of take it to the next level, even if you're scanning and been using ultrasound, but you're looking for more in those acute cases, primary care setting, emergency setting, looking into how to integrate ultrasound. It doesn't replicate, it doesn't sort of, we have to be quite clear that, you will still need X-ray and MRIs when needed, but this is sort of part of your initial assessment. So it might help you on the pathway to escalate. So if you see a lot of hemarthrosis in the knee and you think, okay, I need to escalate to MRI, or you see a cortical defect in the metatarsal and you think it's a fracture. So it sort of gives you more information, which can only be a good thing, especially when you're time poor, and also helps you make that right decision for your patients. So definitely I would recommend that.